Do you see the PowerPoint on the screen?
Yes.
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 Excellent. Well, welcome to the Pre-Solicitation Bidders Conference for our RFP Administrative Process Improvement for Public Health. This is an RFP with the City of Chicago, specifically Chicago Department of Public Health, with the Special Projects and Process Improvement Team, or SPPI. And again, we are recording, and this recording will be publicly available. Preview of the agenda, we'll do welcome and introductions, look at the purpose of the RFP, funding and the timeframe for it, a little bit more detail on the scope of services, evaluation criteria, go over some of the key dates, and then take questions. I'm Jenny Buckley. I direct Special Projects and Process Improvement at CDPH. With me here on the call are Eddie McDonough and Marcus Davis, our project managers. Patricia Brown is also joining, contracts administrator with CDPH's contracts team. Few housekeeping points. Please feel free to put any questions in the chat. We'll take verbal questions at the end. If there is something that you need clarified in real time, please feel free to ask that. We will be posting all Q&A, both for this and any future questions that we get with their answers to FMPS, our current system. Deadlines for any further questions are next Wednesday, February 14th at noon Central. And again, this presentation will be on FMPS as well. I emphasize that this is a summary of this RFP. If there are any discrepancies, always follow the RFP for a full listing of the requirements and expectations. The purpose, the COVID-19 pandemic brought us a great increase of funds to public health. This also highlighted administrative processes that we have that are outdated, manual, and inefficient. And so we are seeking to ensure that we can execute programs and administer funds in the most efficient, effective, and equitable manner possible. So the purpose of this RFP is to support administrative process improvement and automation projects within CDPH's finance, grant administration, staffing, human resources, info technology, and planning operations. And also support CDPH's Special Projects and Process Improvement Team, us, SPPI, to review current state processes, identify opportunities for improvement, leverage existing productivity management and change management tools to automate manual processes where possible, and implement these solutions. This RFP is for a total of $3 million. We have an initial $2,179,943 available, and then pending availability of additional resources. The initial period is July 1st of this year, 2024, for 1 year ending July 30th, 2025. There may be up to 3 extensions, each not to exceed 1 year, at the discretion of the city based on the availability of funds, the need to extend the services and contractors' performance. A little bit more on the scope of services. There are 3 categories here. The contractors will work with CDPH's SPPI unit to support admin systems improvements throughout CDPH. The 3 categories, we're going to award up to 3 contracts under this RFP in Category 1, advising on process improvement, Category 2, process improvement projects, and Category 3, software development projects. And respondents will submit separate proposals for each category for which you want to be considered. More detail on each of these categories. Category 1, advising on process improvement. This will be providing advisory and coaching services for capacity building and process excellence techniques. It will specifically be sessions totaling a minimum of 8 hours per month, educating CDPH staff. with specific potential discussion topics and objectives to be identified during regular meetings with us, the client, SPPI. To give you an idea of what this looks like, past areas of interest include hiring, recruitment, and onboarding processes, procurement systems, and supplier integration, and financial planning, management, and reporting. This will involve methodology that incorporates continuous improvement, change management, and tools such as SIPOC, process mapping, root cause analysis, waste elimination, cycle time reduction, and achieving operational consistency. For the outcomes, we are targeting increasing staff proficiency, applying those key techniques, identification of system improvement opportunities, development of high-level optimization recommendations, and overall building an internal culture of improvement. Moving on to more detail on category 2, process improvement projects. This will be a minimum of 6 projects that the contract will provide consulting services on, focusing on increasing efficiency of administrative functions, enhancing reporting compliance, standardizing operating procedures, and boosting staff engagement and retention. Using methodologies that include project work plans, tracking, and communication with us, current state process mapping, root cause analysis, identification of system nudges, developing future state workflows, and change acceleration and readiness assessments. And with these outcomes, we're aiming for reduced waste and cycle time, increased quality and compliance, adoption of optimized processes, and again, more generally, a sustained culture of improvement. And finally, more detail on the scope of services for the third category, software development projects. This is providing software development and enhancement services for improving and digitizing admin systems with a minimum of 6 projects that leverage Microsoft's Power Platforms. Focusing on human capital management systems, grant and fund management, and contracting and procurement. Using methods, practices, and technologies that include project work plans, tracking, and communication with us, Power Apps for workflow digitization, Power BI for data unification and analytics, Power Automate for process automation, Azure services for scalable solutions, using agile sprints for rapid iteration, and pilots and iteration prior to full deployment. With these outcomes, we're aiming to eliminate redundant manual tasks, to centralize data for a single source of truth, reducing errors, improving reporting compliance and insight, accelerating cycle times for administrative functions, and enhancing user experience. We're using a task order structure. So the contractors will perform the work for each contract pursuant to a task order for each project that we wish contractors to complete. The city and the contractor will execute a task order that details maximum compensation consistent with a contract schedule of compensation, the deliverables, performance schedule, performance milestones and payment schedule, and requirements for the services. We'll move on now to the evaluation criteria. There are 8 of these, and we'll go into detail on the criteria for each of these categories one by one. The first criterion is the implementation and management plan. That accounts for half of all the points, so a lot of weight on this, 50 points out of the 100 that we are looking for. And this is demonstrating your capacity to successfully implement and manage the work in compliance with the scope of service and requirements. What we're looking for category 1 proposals, advising on process improvement, is an advising model and planning that includes engagement and recruitment, waiting to recruit CDPH staff for these sessions, session development, facilitation, and coaching, assessing the impact, and following up. What we're looking for category 2, process improvement projects, is a project methodology that includes these tasks: problem definition and scope, baseline data, root cause analysis, target state definition, and project closure. And for category 3, what we're looking for in the plan is a project methodology that includes these phases: product design, sprints, and deployment, and project closure. Second criterion is technical expertise and capacity. This is 10 points out of 100. For all the categories, we would like you to demonstrate experience with government agencies, as well as these specific areas for each of the categories. For 1, advising and process improvement, industrial engineering, operational excellence, and change management, process improvement, project management using Lean Six Sigma and Agile principles, and consulting and or coaching on process improvement in Lean Six Sigma. The technical expertise and capacity that we're looking for category 2, process improvement projects, is in industrial engineering, operational excellence, and change management, business analytics, process improvement, project management, and project management using Lean Six Sigma and Agile skills. And finally, the technical expertise and capacity that we're looking for, category 3, software development projects, is in software application development, software development project management, IT systems analytics, project management using Lean Six Sigma and Agile principles, and Microsoft's Power Platform, including Power Apps, Power Automate, and Power BI. Excuse me. Third criterion is in the pricing schedule. This is 7 points out of 100. And providing the formats here, these also appear in the RFP. I'm not talking through these, I'll just go to the screen. Different formats for the different categories. Then I'll maybe I use the details of the and if you'd like to pop back to that. All right, then we've got other criteria that relate across all categories equally. This one is risk management procedures. This is 7 points out of 100. Please describe your risk management procedures, including but not limited to how you plan for, identify, and respond to risks, adversity, roadblocks, and other unexpected scenarios. Next criterion is capacity to perform. This is 8 points out of 100. Please demonstrate your capacity to provide the proposed services for the city, including a discussion of any uncompleted projects and or contractual commitments to other clients that will affect your ability to deliver the services or affect the resources to include the project. Provide a summary of current and future client commitments and include details on completion dates. Identify the percentage of the services that will be performed using your own workforce, equipment, and facilities, and the percentage of the work that would be subcontracted. Next is staffing plan, which is 5 points out of 100. This includes a staffing plan that provides the definition. How many staff will receive compensation for this contract, including whether they are full-time, part-time, or hourly. The role of all positions supported by this contract, job descriptions and resumes of staff, time allocation, and job descriptions for any vacant positions or new positions that would be created because of this opportunity. Staff's previous related experience, references, and brief description of the street. The city reserves the right to conduct background checks on any person within the scope of this engagement. An organizational chart, and if one or more agencies, organizations will service a contract to the respondent, to you. Please be specific and outlining staffing plans for each agency. Fiscal capacity, this is 5 points out of 100 for the evaluation criteria. Payment for services will be made on a reimbursement basis. So please, you must demonstrate capacity to fund program expenditures from the start date until they are reimbursed by the city. If multiple agencies will be subcontractors of a lead agency, then the application must be submitted by the lead agency as the respondent. There's more detail in the RFP. An organization may use a fiscal agent to administer the contract. Again, there is more detail on this in the RFP. Finally, last criterion, alignment with CDPH's guiding principles. This is 8 points out of 100. All CDPH investments are guided by the following principles. CDPH contractors are expected to integrate these principles into organizational policy and practice. So please submit information to demonstrate your ability to attain these principles. There are 4. 1 is deconstructing racist systems, actively working to reframe and dismantle systems that perpetuate privilege. 2nd is trauma prevention and trauma-informed services, ensuring that services proactively address trauma and healing. 3rd is cultural responsiveness, ensuring services are culturally and linguistically appropriate. And finally, 4th, health equity in all communities, allocating resources and services to people and areas that have the greatest need in order to attain the highest level of health for all Chicagoans. CDPH's commitment to health equity is operationalized in Healthy Chicago 2025, which is a 5-year health improvement plan to reduce the Black-white life expectancy gap. All right, that concludes the summary. Key dates. Of course, this RFP was released last week, February 1st. Now, this is the bidders conference. Deadline for questions, like I said, is next Wednesday, February 14th. Central. The application deadline is March 1st at Wednesday. Here is our contact information from Laura if you need to get in touch. But yeah, happy to open up for questions.
I have one. Storm Anderson here from Kumo Partners. I was just wondering, I know there's certainly a high level detail to the proposal. Is there any nuances that we should consider around standard licensing, premium licensing, dynamics, out of the box, anything of that sort that should be considered?
I think along the lines of the detail that we ask for on Power Platforms, Power BI, Power Automate, if you believe that that detail is useful and important, please include that.
Okay.
Any other questions?
Good morning, Olga Franceschini, Saldemar Solutions. I have posted 4 questions on the chat. I don't know if you want me to read them or if you would like to read them and respond.
Oh, I see that. Thank you. Yes, we will award up to 3 contracts. There will be one contract per category. It may be the same contractor on more than one category. So it could be separate categories, subcontractors per category 1 for each of the 3. There may be one contractor that is awarded a contract that includes both or more than one category. Does that make sense?
Yes, thank you.
Page 5, section 3, small reference to HR grants. Is the so I'll read this and then I'll clear up this. So page 5, section 3, software list agent grants, focus purchasing. is CDPH considering systems independent from the city of Chicago DPS? Do you mean, are we looking at admin systems improvements for systems outside of the city?
I mean, the city currently has a contracting purchasing system. Is the plan for CDPH to have its own system, including the HR system, separate from the cities, from central office?
No, we are working with existing systems.
Thank you.
Third question, what is the current city agreement with Microsoft? Does it include Azure? We'll confirm that.
Thank you.
Fourth, is CDPH expected a technology assessment and pickup analysis to determine the best management projects? The detail that we provided in the RFP defines what we are expecting. If these components are relevant and useful in your proposal, it's up to you what to include, but I would, what we spelled out in the RFP is what our expectations are.
Okay, thank you.
Therese Wilson, I see a question about MeeBee compliance, minority business enterprise and women-owned business enterprise. This is a federally funded RFP. Our federal, the city's MeeBee program has a geographic preference that our federal funder does not allow. So there is not a component. We did check into that. Oh, posting the link to FAQs. Should be Lady or Marcus for sure.
Hi, are there geographic location requirements? I know some of the city RFPs require that contractors or give preference to contractors located within the city. Is that one of the requirements or preferences for this RFP?
Yeah, there is. Thanks for the question. There is neither a requirement nor a preference. And that also relates to what I was just saying about the funder. There is no geographic preference. We do not have a preference between on-site or off-site. I will qualify that saying that the contractors will have will be officed. They will maintain their own offices. We don't have office space for a contractor. A contractor who wishes to have meetings on site will be able to do that.
Okay.
A contractor does not need to be on site. A contractor could be completely off site.
Thank you. And is
Will
the
there,
budget across each of the three categories, or how is the budget for the full RFP looked at?
Yeah, we will look at the proposals to determine how to allocate the budget.
You didn't ask for budgeting in the RFP. Besides that one graph about the chart about the pricing, is that all that you're looking for as it relates to budget?
Yeah, we do ask for the maximum fee in those categories. So what would the maximum dollar amount be?
is there access to do phase 1, phase 2, and the root cause problem solving sessions and the current state, future step mapping? Is there access to conference rooms that can be used on site where the people that perform the activities exist?
Yes, there is access to that. That's right. I'm gonna quick go through, there are some questions in the chat that we have not gotten to yet. Will the PowerPoint presentation be made available after today's pre-bid conference? Yes, it will be. Are all questions submitted via the online discussion in the e-procurement system? There will be. Patricia, can you speak to how that is set up?
I'm sorry, what was the question?
The questions are all questions submitted via the online discussion in the e-procurement system, or is there another way to submit questions?
All the questions would be in the, you said will all the questions be in the procurement section? I couldn't hear you talking.
Oh, sure. I'm reading the chat. Am I coming out? How is my audio?
Okay, it was up and down during the presentation, but okay. Let me look at the chat. Let me look at the chat. There it is. Okay. Let me move this over. To clarify the task orders. Okay. So which question are we on? Is all the budget? We did that one. Online discussion.
How do people?
Okay, are all the questions submitted via the online discussion in the procurement system, or is there another way to submit questions? It would be in the. It should be in the procurement system discussion, because we're going to be checking that for different questions. But yes, and then there's a contact information where you can send questions directly to the program directly to someone that will get back to you with the information. So it's either or. You can do it via email. We prefer via email, and so we can keep on top of it, which is going to be, the emails are included in the presentation at the end.
And they should be on the screen. They should be
Yes.
on the screen. So yes, Angela, those emails work.
Yes, that's the follow-up. I will direct you there, opposed to the e-procurement system.
Okay, good to know. Thank you. Thanks for clarifying.
The next one.
Yep. Is there a requirement or preference given to contractors located in Chicago? No, there is not.
Okay.
What is the size and scope of CDPH? Number of FTEs? You mean the what our workforces, our staff?
Yes, yes.
It's about 700. Number of departments and divisions. Oh, yeah, we're focusing, that's a good question. There is a number of departments and divisions that fall outside of the admin systems that we are focusing on. What we've identified and spoken about during this presentation are the department-wide admin units, such as contracts, finance, HR. We have not talked about the more operational programs. This work might interact with those programs, but it's not the focus. They have the focus of this work. Did that clarify it? And I went off.
Yes, thank you.
Okay.
Okay.
Oh, good question. Is the budget divided across each of the three categories? The budget is allocated across the three categories.
Correct.
So the total of the three categories will fit into the budget on that funding slide. Does that answer the question, Takia?
Yes, I typed the question in before I asked it verbally, so thank you.
Okay. To clarify, see, Deborah, to clarify, the task orders in this are separate and not related to any existing master service agreements, correct.
Thank you.
Christine, you're welcome. If a vendor will be submitting for two categories, is there a way to integrate the two proposals? They are separate proposals.
Okay. We were looking at the category 1 and category 2 as being quite integrated. And so what would your suggestion be there then? Should we just submit the same proposal for both categories? Because it literally, the way we would propose it would be very, very integrated.
Mm-hmm. Yeah, you know, we thought about that. Yes, if that makes the most sense to convey the content that you want to convey for each of those, then that's your call.
Each category is a different contract. So if you want to be considered for a contract, both contracts, you must submit an application for both, a bid for both.
Okay, that makes sense. We were just curious about, because the way we do process improvement is very, very integrated. So we just wanted to be sure. Thank you for that.
Daniel's question, to what extent, what ways will awardees for each category be asked to coordinate with each other in the execution of their respective scopes? That will be something that we work out once we make the awards. They're not necessarily coordinating. These can be completely self-standing, separate contracts. If there is an opportunity to coordinate, there may be coordination, but it's not necessarily. This will function without that.
Okay.
Does that make sense, Dave? I see that Eddie, I see that Eddie put the link to FNPS in the chat. Thank you. Christine, if we are not yet approved for the e-procurement system, we can submit to a contact on the solicitation, correct? Patricia.
Yes. If it's not, you need to submit via the system, e-procurement system. If you're having trouble, there's contact information to let people know that you're having problems with submitting your application. But that's the only way that we're gonna evaluate the applications is via the portal.
Okay, I'm sorry. My question was a little bit out of, because I asked it back when we were talking about the questions and answers. So it's about submitting questions, because we can't get onto the system until we're approved. We started the process this morning.
Oh, questions.
Okay, that was addressed. We have the Q&A contacts right there. My name is Patricia Brown. I'm the contracts administrator. Just so you know, I logged on 4 minutes after the meeting started. So the Q&A, the questions, where you see right now, those are the contact information with the slide that everyone will have privy to. The contact information is listed for you. You have the name, number, and email. So you can submit all questions via email. We prefer to those contact. Edwin would be the first line of defense, but you can either or will be fine. They will address it as it received, the questions received. So you don't have to go through the portal for the questions.
Okay, I just was confirming that. So thank you for that. I appreciate
Oh,
it.
you're welcome.
No problem.
Yes. Yeah, and thanks for clarifying. All right. David Schwab, wondering if someone can further explain the pricing model for category 1. Let's jump in.
So Jennifer, hi.
Sure.
To clarify my question, so if you don't know how many, it feels like category 1 is asking you to price this based on some sort of solicitations you're doing with groups of CDPH employees, correct?
Yes.
And how would we get a max fee for the category if we don't know how many groups we're going to do? And also, could that price change whether or not that is a virtual session, a recorded session, an in-person session? It feels sort of difficult to figure out how we would possibly price that both per hour and as a total max fee, not knowing, you know, are you talking about 100 sessions? Are you talking about 10? Are there going to be 80 people per session? I mean, it's very variable. So I was wondering if you guys can clarify how we would get to that.
That's, you know, that's a good question. That's a good question. Eddie,
Okay.
Marcus, let's talk about that. Thanks for asking.
If I can just add quickly, as it sounds like you'll have internal conversations about that. I'm also curious if how to represent the costs of planning for the sessions. So, for example, if we're coordinating with our primary contact at CDPH, I assume there's some planning time that will need to go into each session. So, how best to reflect that?
In your, I would like to go back to the pricing. The pricing, we just gave you a grid of different ways in which you can set up pricings. So it's just the estimates. It's not hardcore. It's just the range of how will you price each for one person, groups of 2 to 5, groups of 6 to 10, so you can give a variation of different proposed pricing per session, or if you want to add notation at the bottom or what have you, you can do that. But that's just a grid. We have to be broad, so we make sure that we give everybody an opportunity to bid and give the information. We'll make the assessment based on not just pricing, but the overall scope of work and the task in which you equipped to do. So it's a variation of different evaluation. As she went on, this is evaluation criteria. So yes, some type of estimation of pricing should be available, because maybe you're overpriced or something like that. But once you award it, once we evaluate the proposals and award different vendors for these 3 contracts, we will let you know and negotiate terms and discuss terms more in detail. Is that fair enough to say? Hello?
Let's, thanks, Patricia. Let's consider both of these questions and then follow up.
Okay.
I'm sorry, so I've got David's question. Who asked about the cost of planning? I didn't get the name.
Oh, that Jennifer, this is Shannon Madden from Crow. I can put my name in the chat there.
Okay.
Christine Shaw, is there priority among the 3 categories within the RFP or among the 6 functional areas listed in the section? No, there's no.
Thank you.
Paula McCabe, do we anticipate that task orders issued from the 3 categories will be issued sequentially? No, concurrently. Christine, what are the roles and responsibilities of the members? SPPI in addition to the units director? Our project managers manage the various process improvement and process automation projects that we take on, and do some consulting and advising as needed with CDPH staff. The RFP mentions the minimum of 6 process improvement initiatives for the areas of focus that are on page 4 of the RFP. Are there priorities identified among this? Oh, okay, so I think the operational here is priorities identified among 6 functional areas.
Mhm.
No, these are not prioritized relative to each other. Is there a process improvement process in place at CDPH? Yes, this is exactly what we're doing. Is that what you meant, Christine?
Actually, I was looking at, what type of, like, what system of process improvement maybe that you are already utilizing. I know you mentioned SIPOC, but I was just kind of curious.
Yeah, it's been, yeah,
No.
we draw on a really broad range of tools, depending on the situation or program and the capacity.
Okay.
Greg
Thank you.
Williams, oh, you're welcome. Will the city publish a list of attendees to this meeting? Tricia, what is the practice here? Do we publish a list of meeting attendees for the bidders conference?
No, okay. Will the city publish a list of attendees to this meeting? I'm not familiar with that. I don't think we would, publish that. It's more of a,
How about
I'm not familiar with that. We can follow up with that. I don't believe so, though.
Okay, that's it for the questions in the chat. I saw hands up earlier and they came down. Were there any verbal questions?
Jennifer, this is Jonas from Whipley. I just put one in the chat. Is there anything you can tell us about the current software technology stack that you're using?
It is mostly Power Platforms. Is that what you meant? Eddie, Marcus,
you.
would you like to add anything?
Do you want me to include like our personnel and finance system, like FNPS and like Oracle and business objects, that kind of thing?
Yeah, in the city's use, yes. Anything else? Thanks, everyone, very much.
There's another.
Oh,
Yeah, I just added one. I'm sorry.
okay, no, that's all right. That's all right. I know we're over time. I appreciate people's extra time.
She said, is the scope limited to the MS apps?
Olga
Yeah,
Francescini again, with Soldemar Solutions. Actually, there's a question before my question, I believe, but yes, that's Microsoft Office applications.
Yes, that's the MS app.
Yeah, and we responded to the question before yours about current technology.
There was
So
my question. I'm sorry. There's another question in there about the actual solicitation requirement of the 4,000 character limitation.
yes,
For,
yes, thanks.
So, or is there a location to upload the proposal? That's what that was kind of what the question was there.
Okay. Oh, the 4,000 character limitation with space.
Yeah, Patricia, that's a good mechanical question for you, or we can also check and get back.
Okay, with spaces and well, the words will be counted. The characters, it said character, yeah. So it might with any application when it say 4,000 characters, that do include the punctuations and and everything. It
But I
entails.
think I think the question is
I didn't read all of it.
can we also can respondents also upload a proposal? There's a character limit.
Yes, you could upload the proposal, but according to the character limit, you may be disqualified. Depends on the evaluation of it. Because with any proposal, you have to follow the guidelines and procedure. If it's at 4,000 characters, you need to be, that's the limitation. So when you upload it, I'm sure that it's an automatic counter in characters. So I don't think it would X you out, but it would notate that you over exceeded. I'm sure of that. But you could still be, you could be still considered. That's a call that you have to make. But you know the guidelines said 4,000 character, and that include punctuations.
So, okay, so I do think, I mean, it would be helpful to have clarification just to be sure we're, you know, is it, because it, you know, just because, you know, the questions are separate. So, I mean, surely you don't want to read 4,000 characters per question there on your, on the RFP, but maybe.
That was just,
so that's, I just want to be sure we know how to best submit and most efficiently for you.
Well, no, each question will have, that, I think that's for the scope of work, 4,000 character. Everything else is not, each question have their own limitation, but that's just like for a grant application, a contract, this is a contract application. They have character limitations, and that's for the scope of work only. It should be for the scope of work only. So when you upload it with your scope of work, that passage of what you're going to do and everything within that scope of work responds, like a research plan and a grant administration application. It's the same. They have a limitation of 12 pages, 10 pages, 6 pages, or a limitation of 350 words or characters. That's something, a red flag, but we can get back to you as far as you could send us an email, send an email to the contact so we can confirm that. But yes, it is a 4,000 character limitation. So to be specific, you can email us that with the Q&A information that we gave you on the last page. You can email Edwin and he will get back to you and whoever else is want to inquire about that the character limitation. But it is what it is. It's 4,000 character limitation. And what session is that in? That's for the scope of work, from what I understand. So yes,
I was trying to. Yeah.
Yeah, it says okay. SOW process implementation plan. Yes, need to be incorporated into solicitation requirement form. Yes. It's 4,000 character limitation. So you have to word it to fit in all your points into 4,000 characters.
Okay. So I have one other question, and I know we're over time, but so the questions that are posed.
Sorry, Christy, I just want to get to Olga's other question here, and then I do want to hear yours. Is the scope limited to MS apps? No. Sorry, go ahead. Let's make sure we hit that one.
So the questions that get posed via email to folks, will those be posted somewhere for all of us who are interested to see?
Yes.
Okay. Because like I said, until we're able to get onto that procurement side, I wasn't sure how we would get that. So that was I just wanted to be sure we had opportunity to see the questions before Wednesday.
Patricia, how does that work outside of e-procurement?
Pardon me?
How would Q&A outside of this session are posted online, but are they available outside of e-procurement?
Are they available outside of,
If somebody does not have access to e-procurement yet, can they
no,
still see?
I don't believe they are. I don't believe they are because not
Okay.
everybody have the same questions. This is the Q&A right here. The Q&A we answering here, I don't think that it would be follow up and posted there as a list. That's why we gave contact information. Not everybody wanted to know the same information. Now, the question, was it answered the last part of the question? The next question was about is the scope limited to Microsoft apps?
I did, I said no.
Okay, thank you, because I didn't see that was a requirement either. Just want to make sure, but no. But we can look into that, but most likely no. You ask questions and we answer them. And that's just what it is. But this right here, I don't believe that if we would go back into that, it would be posted. Again, everybody wants different information, so. You contact us and we'll answer it as received. It won't be posted in the e-procurement.
But Q&A is available in e-procurement,
Yes,
correct? Yes.
yes,
It won't be outside of it.
right. But if they don't have access, you stated
Right,
if they don't have,
right.
right.
Any other questions?
This has been very helpful. Thank you.
Thank you.
Right.
Good discussion. Thanks, everybody. Good weekend.
Thanks, everyone.
Thank you. I'll take care.
Okay.
Thank you.
Bye.